Right, let's talk about measles. You might think it's some old-fashioned disease, a relic from childhood stories or history books. But here's the thing. Right now, measles cases in the United States are soaring. In fact, the country's on track to hit a 30-year high for infections. That's the worst spike in almost 2 decades. So what's actually going on? First, a quick refresher: measles is incredibly contagious. We're talking about a virus that can linger in the air for hours. If someone coughs or sneezes, and you walk through the same space even after they've gone, you could catch it. And it's not just a bit of a rash and a sniffle. Measles can lead to serious complications, especially for children. Things like media group, child receiving oxygen for pneumonia, hospital staff checking x-rays, pediatrician treating sick child at stock at distribute_equally, pneumonia, or even swelling of the brain, which can be life-threatening. Now here's the part that stings. We actually have a super effective way to stop measles: the vaccine. It's been around since the 1960s, and the data is rock solid. In communities where lots of people get vaccinated, the disease almost vanishes. But recently, measles has started clawing its way back, and it's no coincidence. Most of these outbreaks, they're happening in places where vaccination rates have dropped. Sometimes it's because people can't get easy access to doctors. Other times, it's a result of misinformation or distrust about vaccines. And while most parents do vaccinate, just a small drop in the number can give measles a way back in. But there's another twist. At the national level, there's been some shakeup in how vaccination recommendations are made. The Health and Human Services Secretary recently replaced the entire CDC Vaccine Advisory Panel with new members. This has worried some pediatricians who rely on the panel for unbiased, science-based advice. The panel's meant to be independent, using the latest studies to guide decisions, and any change can cause a bit of uncertainty. Here's the bottom line. Measles isn't just a childhood bug. It's a real threat, but it's also one we know how to fight. Getting vaccinated doesn't just protect you. It protects everyone around you, especially media group, children playing together, pediatric nurse with young patients, group of kids at school at stock at distribute_equally, kids, and people who can't be vaccinated themselves. With more cases popping up than we've seen in decades, now's the time to trust the science, look out for each other, and make sure measles goes back to being just a story from the past. Let me know in the comments, did you know measles was making a comeback? And what questions do you have about vaccines? Hit like, subscribe if you want more explainers, and stay safe out there.